Once you're diabetic, for more than 12 to 15 years, you start to develop complications, especially even early if you have those diseases uncontrolled, meaning that you don't take your medications, you eat whatever you feel like, you don't know how your sugar is. The same goes for hypertension. And with time, it causes damage, not only to your kidneys, but other organs, but the kidney is one of them. And I would say like 12 to 15 years, that's when you start to see the manifestations. There is what we call acute, right? Meaning that it happens when you're sick. Anybody can have that. Like let's say you get nausea, vomiting, diarrhea, or you develop dengue or some other form of illness and you go to the hospital. There's like a 3 to 4% chance that you may develop acute kidney injury, but your kidneys usually recover from that. But then there's chronic kidney disease, which is usually secondary to some underlying problem. And as I mentioned before, the most common etiology would be, or the cause would be, diabetes and hypertension. What the other things that can cause it would be genetic. So sometimes in specific groups, you may find that they have, like the father, the son, the daughter, they have kidney problem. They end up on dialysis. Then there's other diseases that can cause kidney disease as a manifestations. For example, autoimmune diseases. The most common would be lupus. There's also drugs that we use on a common day-to-day basis, especially the elderly population. They go over the counter, they buy ibuprofen, they buy diclofenac for joint pains, and then over a long period of time using it, they can also damage the kidney. Once you have kidney disease, you may have eye disease as well, because it comes hand in hand. Say at the same time, around 15 to 20 years, when you have kidney disease, your eyes are affected. And kidney disease also increases the risk of heart disease, right? And vice versa. Heart disease increases the risk of kidney disease. So you're talking about multiple things happening, and the major cause of death in kidney disease patients is heart disease.